Hi all, welcome back to my channel. I hope you guys are doing good. Today I'm going to discuss about PEWS, that is Pediatric Early Warning Score. Let's move on to the topic. Pediatric Early Warning Score. The main purpose is to identify pediatric patients at risk for clinical deterioration. It enables the early recognition of sick patient and management of any deterioration. It's been categorized according to different age groups, that is from 0 to 11 months, 12 to 23 months, 2 to 4 years, 5 to 11 years, and more than 12 years. In this, I am going to explain about 2 to 4 years. The main parameters are oxygen saturation, respiratory rate, heart rate, systolic blood pressure, conscious level, body temperature, and capillary refill time. I am going to explain the criteria for 2 to 4 years. It is not uniform universally. It may vary from hospital to hospital based on its policies and protocols. The main parameters are oxygen saturation, any supplemental oxygen, respiratory rate per minute, heart rate per minute, systolic blood pressure, conscious level, body temperature, and capillary refill time. And the color codes are: green means you can give a score of 0. If it is yellow, give a score of 1. And if it is red, go for a score of 3. The first parameter is oxygen saturation. If the oxygen saturation is more than or equal to 94%, give a score of 0. If the oxygen saturation is between 92 to 93%, give a score of 1. If the oxygen saturation is less than or equal to 91%, then give a score of 3. The second one is any supplemental oxygen. If the baby is on room air, give a score of 0. If the baby is on any supplemental oxygen less than 4 liters per minute, give a score of 1. If the baby is on any supplemental oxygen and the flow rate is more than 4 liters per minute, then give a score of 3. The next one is respiratory rate per minute. If the respiratory rate is between 20 to 34 breaths per minute, give a score of 0. If it is between 35 to 49 breaths per minute, give a score of 1. If the respiratory rate is more than or equal to 50 breaths per minute, give a score of 3. On the other hand, if the respiratory rate is between 15 to 19 breaths per minute, give a score of 1. If the respiratory rate is less than or equal to 14 breaths per minute, give a score of 3. Next one is heart rate per minute. If the heart rate is between 90 to 139 beats per minute, give a score of 0. If the heart rate is between 140 to 149 beats per minute, give a score of 1. If the heart rate is more than or equal to 150 beats per minute, give a score of 3. On the other hand, if the heart rate is between 70 to 89 beats per minute, give a score of 1. If the heart rate is less than or equal to 69 beats per minute, give a score of 3. The next parameter is systolic blood pressure. If it is between 80 to 99, give a score of 0. If it is between 100 to 119, give a score of 1. If the systolic blood pressure is more than or equal to 120, give a score of 3. On the other hand, if the systolic blood pressure is between 70 to 79, give a score of 1. If the systolic blood pressure is less than or equal to 69, give a score of 3. The next one is conscious level. If the baby is alert, give a score of 0. If the baby is responding only to verbal or painful stimuli or unresponsive, give a score of 3. The next one is body temperature. So if the temperature is between 36 to 37.9 degree Celsius or 96.8 to 100.22 degree Fahrenheit, give a score of 0. If it is more than or equal to 38 degrees Celsius or 100.4 degree Fahrenheit, give a score of 1. If the body temperature is between 35 to 35.9 degrees Celsius or 95 to 96.62 degree Fahrenheit, give a score of 1. If the body temperature is less than or equal to 34.9 degrees Celsius or less than or equal to 94.82 degree Fahrenheit, then give a score of 3. The last one is capillary refill time. So if it is less than 2 seconds, give a score of 0. If it is between 2 to 4 seconds, give a score of 1. And if it is more than 4 seconds, give a score of 3. Respiratory distress is the another important thing we should look for whenever we are counting the respiratory rate. It's divided into mild, moderate, and severe. In mild respiratory distress, the baby will be having nasal flaring and subcostal recession. In moderate, baby will be having head bobbing, tracheal tug, intercostal recession, inspiratory or expiratory noises. If it is severe, then you can note sternal recession, grunting, exhaustion, and impending respiratory arrest. In the picture, you can see a baby in respiratory distress. So let's see about PEWS score interpretation. So if the score is 0 to 2, the baby needs 4th hourly vitals monitoring and routine resident review. If the score is between 3 to 4, the baby needs 2nd hourly vitals monitoring and frequent review by resident or PICU fellow. If the score is between 5 to 7 or more than that, the baby needs hourly vitals monitoring. Better to inform the consultant and transfer of the baby to PICU. Thank you so much for watching this video. I hope this would be helpful for you guys. If you feel the same, kindly like, share this to our friends and subscribe my channel. My channel name is Jebin Shine, and don't forget to press the bell icon button so that you will get the notifications whenever I am uploading new videos. Thank you all once again. See you all again with one more interesting topic. Until then, it's bye from Jebin. Bye bye. Take care.